Hi everyone, I am Jessica Bandera and I am one of the reporter of Group 7. Our topic we were going to discuss about dimension of development first aid education. So what is first aid? First aid is the immediate treatment using available facilities or materials and giving to an injured or ill person while waiting for medical service arrive. So why we need to tackle or why is it important to know what is first aid and how it doing a first aid? Some of the reason why first aid is important is to control pain. Second, save lives. Third is not to cause a lot of pain. Then, the purpose of first aid is to minimize injury and future disability. So, in some cases or in some situation, if a patient doesn't receive a basic first aid care immediately, their situation will deteriorate often rapidly or it cause a lot of pain. So, by being able to provide basic care, you can stabilize patient until emergency medical service arrive. Next, first aider. The first aider deals with the whole situation, involving the patient and the injury or illness. A first aider is an individual that has been trained to give basic medical help and support to someone injured or unwell. They are not a qualified medical professional, but instead someone that has been given training and assessment to qualify them to safely provide first aid. So, as a first aider, you need or you must be kept in your mind the 3 P's of a first aider. First, preserve life. Second, prevent deterioration. Third, promote recovery. That are the 3 P's that you need or you must be kept in your mind. And the characteristic of a good first aider, you must be gentle, resourceful, observant, tactful, sympathetic, consoling, and also are respectful. That are the good characteristics of a first aider. So next are the rules and responsibilities of a first aider. First is, since the first aider does not perform the function of a doctor or compete with the latter, he or she immediately transfer the medical task and care of the victim to a qualified physician who comes to the rescue. Second, he or she ensures the safety of bystanders. Third, he or she assesses the condition of the victim's life. Fourth, he or she identifies the risks or threats to the victim's life. Fifth, he or she calls for medical assistance as needed. Sixth, he or she provides the immediate and necessary care. 7. He or she assists the medical personnel. And last, he or she records the situation, care given, etc. So all of that are the rules and responsibilities of a good first aider that you need or you must be followed. That is one of the important things to be remembered for you to become a better first aid person. Next are the basic life support. Life support is a series of emergency life-saving procedures that are carried out to prolong the life of a victim. It is clarified under the 3 types. One is BLS or the basic life support. Second is ACLS, advanced cardiac life support. And the third is prolonged life support or PLS. So when we say basic life support, is an emergency procedure that consists of recognizing respiratory or cardiac arrest or both and the proper application of cardiopulmonary resuscitation or CPR to maintain life until a victim recovers or advanced cardiac life support that can be administered. So as previously mentioned, basic life support is a part of CPR that can be used in life-threatening emergency situations. So it involves high-quality chest compression. So next are the ACLS or the Advanced Cardiac Life Support. Is the use of special equipment to maintain the breathing and blood circulation of the victim. So in this part is nagagamit na siya og mga equipment, machines para ma-maintain ang breathing and the blood circulation of the victim. So that's why it called it Advanced Cardiac Life Support para masuportahan ang breathing and ang blood circulation of the victim. So next are the prolonged life support or the PLS. Is the post-resuscitation and long-term resuscitation. So in this part are treatment available that may prevent people from dying. So dito is gumagamit rin siya ng mga equipment or machines to prolong life of the victim. That's why prolonged life support para ma-prevent ang victim from dying. Next are the chain of survival. Chain of survival has 4 links. First link is early access to the emergency response system. Second link is early CPR to support circulation to the heart and brain until normal heart activity is restored. Third link is early defibrillation to treat cardiac arrest caused by ventricular fibrillation. Last is early advanced care by EMS and hospital personnel. The first link, early access to the emergency response system, includes early recognition of the cardiac emergency and early notification of rescue personnel via a universal 112 telephone system or 911 in Philippines, as well as an internal alert system within specific facilities to trigger a response by designated trained and equipped personnel. The second link, early CPR, is a set of actions that the rescuer performs is sequenced to assess and support airway, breathing, and circulation. The third link, early defibrillation, is a delivery of a shock to the heart to convert the heart's rhythm from ventricular fibrillation back to a normal heart rhythm. It is the key intervention to increase the chances of survival of the patient outside without hospital care. The fourth link, early advanced care, relates to the response of highly trained and equipped pre-hospital EMS personnel or who can respond to the patient and provide for the administrations of drugs, advanced airway procedures, and other interventions and protocols prior to the arrival of the patient at an advanced care facility. Note: the immediate of the first aider are the ease the pain, prevent further harm or danger, and extend the life of the victim. Furthermore, the first aider must eradicate the hand cranes and giving the initial interventions such as the surroundings, curious and unruly crowd, the victim's relatives, panic, pressure, etc. It must be remembered that the safety percentage of the first aider is 80% and that for the victim is 20%.
Good day, sir. My name is Ruchi Estancia, and this video I discuss about emergency. What is emergency? Emergency is a serious, unexpected, and often dangerous situation requiring immediate action. There are some examples of emergency situation. Chest pain, stroke, bleeding, burns, choking, heart stroke, fire, flood, accident. Emergency action principle. Survey of the same victims in every emergency. They had three basic actions: check, call, care, and for advice. They have check for danger, for check for response, open airway, and checking breath. 5. Emergency management. They have prevention, mitigation, preparedness, response, and recovery. And now, let's find the solution in the scene of survey. This is the scene of survey. In an emergency action principle, they have two kinds of survey: a primary survey and secondary survey. Primary survey is checking the airway for breathing and blood circulation. We have three types of secondary survey. First is interview the victims. Second, check the vitals. And third, perform head-to-toe examination. Interview the victim. Ask victim name, ask what happened, assess the sample history. This is the sign sample. Second, check vital signs. Is pulse rate, respiratory rate, temperature, blood pressure, skin appearance, pupil reaction. Third, perform head-to-toe examination. Head-to-toe examination must be conducted. This is when able either to see there is a deformity, confusion, abrasion, puncture, bleeding, tiredness, laceration, or swelling, or that's called decap BTLS. There are some questions in survey the same. First is the same safe? For me, yes. Because I reading the book, The Scene of Survey, they explain all things we have an emergency. Some people it come got panic and out of mind. So we need to know a basic action of emergency. What happened? The victim such as signs and symptoms allergy. An event prior to the incident. How many were injured? Actually, they don't tell exactly how many injured. And based on my understanding, I think it was adult. Are bystander who can help? Yes. Bystander help to call ambulance or physician. Emergency rescue. Emergency rescue is the quick transfer to patient from unsafe to safe place. There are 6 indications for emergency rescue. Of fire explosion. Most people who die in fires from the toxic gases, thick smoke, and lack of oxygen. Toxic gases are asphyxia. When you get enough oxygen in your body, damage to living cells and tissues, serious disease, or extremely case of death. Third, serious traffic hazard. This road hazard like causing car accident or other accidents in the road. Risk of drowning is a leading cause of death for child or infants under 1 to 3 years old. Of all drowning occurring bathtub or swimming pool. Danger of electrocution. This is a dangerous source of electricity. Danger of collapsing wall. Types of construction accidents such suffer severe injuries such as death, paralysis. Method of rescue. Method of rescue. They have two methods of rescue. First, for immediate rescue without any assistance, drag or fool the victims. So, this is the example of drag or fool the victims. Second, most of drag, carry, lifts, and other transfer methods can be used as methods of rescue. Transfer is a moving a patient from one place to another place after giving a first aid. Criteria for selection as a method of transfer to transfer. First, nature and severity of injury. Second, size of the victims. Third, physical capabilities of rescuer. Fourth, ability of equipment for evacuation route. Number 6, distance of the place wherein victims will be transferred. And now, this is the guideline to following the transfer. First guideline is victim's airway must be maintained open. Second, hemorrhage is controlled. Third, victim is safely maintained in the correct position. 4. The victim condition is regularly checked. 5. Supporting bandages and dressing remains effectively applied. 6. Method of transfer is safe, comfortable, and speedy as circumstance permit. 7. The patient body is moved as one unit. 8. The taller first aiders stay at head side of the victims. 9. First aider barriers must be observed ergonomics in lifting and moving the patient. Methods of transfer. Keep the person's head, torso, legs in line during the transfer person to move safety. Left with your legs, not with your back. Now, let's know how to rescue with no assistance. One-man assist carries drugs such as to walk, carry in arms, carry in a backtrap method, carry in fireman ways, blanket drag, arm free shoulder, drag cloth, feet drag, and incline drag. Two-man assist such assist to walk, forehand, sit, hands, and letter carried by extremes, fire carry with assistance. Three-man assist such as hammock carry and bearer alongside. Cloth material commonly used in first aid. First, dressing in any germ fabric material used to plaster wood. That's all my presentation about emergency, and thank you for watching.
Now, I will show you my step-by-step how to make the type of bandage. We have 5 examples and steps on how to make a knot. So first, we have a shoulder bandaging. Second is the elbow bandaging. Third is a triangular bandaging. Fourth is the leg bandaging, knee bandaging, and the last one is the hand bandaging. This is the step of how to make a knot about bandage. First step, take one bandage across the chest and the other across the back and the underarm opposite the injured shoulder. Second step, tie the end with a non-shaped knot that is figure 2. Make a extended cravat bandage by using 2 triangular bandage. Then place the end of the first triangular bandage along the base of the second one. Third step, fold the 2 bandage in the single extended bandage. Fourth step, fold the extended bandage into a single cravat bandage. After folding, secure the trichet back or overlap with a 2-month safety pin. This is the shoulder armpit cravat. The step how to do the arm injury. So first, start the armpit across over the injured shoulder and tie the opposite armpit side of the front. Elbow injury. Bend the arm at the elbow and the place of the middle of the cravat at the point of elbow. Bring the ends upward. Bring ends up and across each other in overlapping spiral turns. Last, bring ends to front and elbow on tie. Hand bandage. This is the step how to place hand in the middle of the triangular bandage with the waist and the base. Next, place the apex over the fingers and tuck any excess material into the plates on each side of the hand. Last, cross the end on top of the hand. Take them around the waist and tie them with a square knot. Next is cravat of the forearm, arm, leg, and the thigh. The first step is place the center of cravat over the dressing. Second, begin the ascending turns with upper and the descending turns with the lower end. And the last one is that terminate by tying both ends in square knot. The knee injury. First step, start on the top of the knee, cross the over with the twice, 2 or 3 times under the knee. Third, cross over the top, full ends to opposite sides, and the last, secure with a square knot under the knee.